McMullen. I'm a psychiatrist, and I went to Georgetown Medical School, which was a wonderful experience, and then I did my residency at Columbia Presbyterian, and I've been in practice in New York City and in Mount Kisco for 36 years. I've mainly concentrated on using medications for psychiatric disorders, but I want to talk about treating pain with TMS. TMS has turned out to work for a few psychiatric disorders, including OCD and depression, and bipolar depression especially. And it's also been found to work for various neurological disorders, including Tourette syndrome, seizure disorder, chronic pain, and stroke rehabilitation. I want to talk about stroke rehabilitation. And let me explain a little bit of what happens when you have a stroke and why it's hard to get better. When you have a stroke, say your right arm is somewhat paralyzed, it's because there's a lesion on the other side of the brain, on the left side, in the area that controls the arm. There's been a stroke, a lot of brain cells have died there, and as you do rehab and work your arm until you can get a little better control of it, that's called using the plasticity of the brain to improve function. That the neurons can change, and so you can take neurons that are nearby, that are normal neurons, and they can start functioning to take care of the arm movements. Now, a problem with a stroke is that when this area has a lesion, then the exact opposite area of the brain becomes hyperactive. And so that hyperactive area sends signals through the corpus callosum to the area of the lesion, and they send inhibitory pulses, so they inhibit the area of the lesion from improving. So your own brain is holding you back from the rehab. So there's two ways of doing TMS to help strokes, and they've been doing this at Burke Rehab and other places. One is to do a stimulating treatment in the area of the lesion, and that increases the plasticity there and increases the growth hormone of the brain, BDNF. It's called brain-derived neurotrophic factor. But another way that works as well or better is to do an inhibitory treatment over the good area. So you use an inhibitory 1 pulse per second TMS treatment that calms down that area underneath the coil, and then you're preventing that area from inhibiting the area of the stroke. And so then that area is no longer being tonically inhibited, and it can begin to repair itself. This is really exciting because this is a simple, safe way to improve and speed up rehabilitation after a stroke.